Hi everyone, Dr. Remy from Pain Free and Fit and Posture Size. Today we're going to be going over the most dangerous exercises to avoid if you have cervical degenerative disc disease, and we're going to go over the modifications to help you work out but stay pain free and fit. So keep in mind that cervical or neck degenerative disc disease, the stresses that are imposed on those discs many times come from asymmetrical postures and movement habits that we all tend to develop over a lifetime. What I mean by that is many of us have a tendency to tilt our head to one side, to turn more to one side than another, to hunch or round or abduct or downward rotate one shoulder blade more than another. And these postural issues come out even more so when we're exercising because we rely on what we've developed. If we've developed the tendency to move asymmetrically to one side, the stress from the shoulder blade through the trapezius, levator-scapular muscles, rhomboids that come up and affect the neck structures are going to be aggravating and pulling on that structure. If we have a tendency to have forward head posture where the ear is beyond the vertical line of the shoulder and the hip, that's going to stress the bottom of our neck. And most cervical degenerative disc problems are at the bottom of the neck. And flexion, or moving forward, has a tendency to compress that disc more. The more pressure that's on it, the more you're going to feel pain, the more it's going to aggravate your condition. So we begin by learning what a neutral spine or a safe spinal position is. That's one where we have our shoulder blades flat, not rounded, avoiding any hunching or winging, or as I said before, abducted or downward rotated positions. We avoid any side tilting. Even a millimeter this way compresses this side of my spine, overstretches this side of my spine. That's imparting stress to my disc. We're keeping the ear over the shoulder and avoiding that forward head posture. If you're not sure what your mechanical issues are or your postural situations are, I invite you to go to either the Pain Free and Fit or Posture Size websites. We have a free body analysis and you can learn what your unique situations are so you can hold those corrections while you're exercising and avoid the traumatic effects of improper posture on your neck structures. So the 6 exercises we're going to go over today and their modifications are so common. I see them all the time in my patients, whether they're athletes or just people looking to stay in shape, going to the gym several times a week. If you modify these 6 exercises, you're going to stay out of trouble by holding your head and neck and shoulders in a neutral position while you avoid them. So the first mistake is behind the neck pull down. So if I'm on a lat machine with a bar, and I'm pulling the bar behind my head, there's a natural tendency to goose my head forward so I have room for the bar to come to the back side of my neck and the top of my shoulder blades. So the correction with that is only to do front lat pull downs where now I can keep my head and neck back and I can avoid that flexion stress on the bottom of my neck. So lat pull downs are much safer. If I'm doing shoulder presses with a bar, either seated or standing, when I come from behind, I'm going to have the same problem. I'm going to move my head forward to make room for the bar. That's again causing my neck to move forward, putting direct stress on the bottom of my cervical spine, my neck, my lower discs. So again, the option is a forward press where I can keep my head and neck back, shoulder blades down without hunching up, because that's another typical tendency I see with overhead pressing, is there's a elevation problem because the upper trapezius is stronger than the lower, the shoulder depressors. So you want to keep your shoulder blades down as they rotate outwards as I'm pressing up. Again, keeping my head back, avoiding that flexion problem on my neck. If I'm doing dips and push-ups, same thing. As we go lower in either the push-up or a dipping motion, we have a tendency to move our heads forward as we get low. That again is putting flexion stress on the neck. So besides in all of these exercises holding your unique corrections, meaning if you lean to one side, you need to bring it to neutral. If you round or have a problem with your shoulder blade, let's say shoulder blade tipping, you want to hold that at neutral. That, along with decreasing the range of motion so you don't go as low, will give you initially the strength to hold your neck in a proper posture. Now the lower you go in a push-up or a dip, it's going to be harder to hold that. So I suggest is working at the upper range of motion on these exercises first, emphasizing your neck stability before you get into deeper motions, because it's going to take a lot more stability strength to hold that head in position here than it will out here. And there's no sense in holding it here and losing it at the bottom and stressing your neck. If we're doing abdominal work, the typical mistake is people have a tendency to lead with their head and neck. What we want to do is we want to stabilize the neck, not only with our unique corrections, but generally by looking past our cheekbones towards our collarbone. If we keep our eyes looking towards our collarbone, we're going to be able to lead with our lower rib cage in the abdominal motion and avoid that forward head posture. If we're doing yoga downward dogs and we have a tendency in the upper position to drop our head, we're inviting the same type of stress on our neck. So again, we want to keep our head and neck back in a much more neutral alignment. That's going to allow us to decrease the stresses on those lower cervical discs. So if you keep these exercises and modifications in mind while you're working out, as well as your unique RPIs or reverse posture isometrics, the corrections of your shoulder blade, head and neck, you're going to go a long way in decreasing those injurious stresses that are causing your pain and aggravation. If you like this video and you want to learn some more, I invite you to subscribe to our channel. We have a lot more stretching and strengthening exercises, conditioning exercises for the neck and the shoulder blade region in terms of getting those areas into proper posture and mechanics, so it will support the work that you're doing while you're trying to stabilize by just holding these areas while you're exercising. If you like this video and you'd like me to share it with others and help me along with that, give me a thumbs up below. That'll really help. And any questions or comments, I'd be delighted to try to make a video on them and get back to you to answer them. Hope you enjoyed this series on exercises to avoid with cervical degenerative disc disease. I hope it helps your training and your ability to stay pain-free and fit.